morning, my name is Angela. I'm going to be your nurse today, and I'm going to be performing a full head-to-toe assessment on you. I see that you have no visitors in the room and that the bed is in the lowest position. The ground is free of clutter and you only have 2 side pillows, so that is good to go. It says on my chart that your name is Madison Hancock, your birthday is 01/21/2003, and your medical record number is 12345. I'm just going to verify that with your wristband. Can you verify your name and date of birth for me?
Madison Hancock 01/21/2003.
Alright, and your wristband says that your medical record number is 12345, which matches up with my chart. Do you have any allergies before I get started?
Penicillin.
Penicillin? Okay. I'm performing hand hygiene, and I'm going to don clean gloves at this point. So just based on some general inspection things, I see that your breathing is open and unlabored. Your skin appears to be pink or expected for your race, and your skin looks dry. You don't look like you're sweating or anything, and it appears warm. And you are alert and responding to my questions. So I'm just going to discuss your vital signs real quick with you. So it looks like your blood pressure was 156/76. We typically like a blood pressure to be we like a blood pressure to be 120/80. So your top number is just a little bit higher than we'd like. So I'm going to speak to the doctor about that. Your pulse rate, or how many times your heart beats per minute, is 88. So that is good. We like it to be between 60 and 100. So you're right in the middle of that range, which is really good. Your respiratory rate, which is how many times you breathe per minute, is 20, and we like that to be between 12 and 20 breaths per minute, so you're right at the top of that range. So it might be a little bit high, but we can see about lowering it and stuff like that. Your temperature is 100.4, which is like the very start of a fever, and that could be due to a couple of things. So again, I'm going to speak to the doctor about that. And your oxygen level is a 96%, and we like it to be above a 95. So doing good, you're above a 95. Your blood pressure and your high respiratory rate can be because of some pain you may be experiencing. Are you experiencing any pain at this point?
Yeah, a little bit.
Yeah, okay. When did it start?
I don't know, probably a couple days ago.
Okay, would you say like maybe 3 days ago?
Yeah.
Okay. And where's this pain located?
Right in my lower abdomen.
Okay, it's in your lower abdomen. And is it like a come and go kind of pain, or is it always?
It's more come and go.
Come and go? Okay. Is it like a sharp pain, a dull pain?
It's kind of like a burning.
A burning kind of pain? Okay. That's good to know. Does anything aggravate it? Maybe moving or going to the bathroom?
Moving and going to the bathroom.
Moving and going to the bathroom? Okay. Does anything relieve it?
Pain meds.
Pain medications? All right, that's good. Have you been doing anything to treat it at home?
Just taking like ibuprofen.
Okay, how many milligrams of ibuprofen do you take?
Probably like 600 to 800.
600, 800? Okay. So 600, 800 milligrams of ibuprofen are noted. On a scale of 0 to 10, how would you rate this pain?
Probably about a 5.
A 5 out of 10? Okay, that is good to know. So now I'm just going to move on to the rest of my head-to-toe assessment. I'm going to raise the bed up just a little bit so it's at my waist level. And I'm going to put this side rail down. Alright, can you verify your name and date of birth for me?
Madison Hancock 01/21/2003.
Alright, thank you very much. Do you know where you are right now?
In the hospital.
You're in the hospital. Do you know what day it is?
November 3rd.
Alright, very good. Now can you smile real big for me? And can you stick out your tongue? And can you raise your eyebrows? Alright, facial symmetry is noted, and facial expressions are appropriate for what I'm asking. Now I'm going to look at your mouth. Can you open real wide for me? Alright, oral mucosa is pink and moist. And are these your real teeth?
Mm-hmm.
Alright, so no dentures and all teeth are intact. Have you had any trouble swallowing lately?
No.
No? Okay. Now I'm just going to check your pupils for their just reactiveness to light. Alright, so just look at the tip of my nose for me. Pupils are equal and rounded, reactive to light. And can you look over there and then look back at my finger? Alright, pupils accommodate correctly as well, and they are 4 millimeter in size. Alright, now I'm going to move down to your chest. Now at this point in the exam, I would probably unbutton the gown and ask her to kind of keep it at chest level, but just for the sake of this video, I'm not going to do that. Okay, now can you take a big deep breath for me? Alright, patient has equal bilateral chest expansion. Have you had any trouble breathing lately or any chest pain? No? Okay, that is good to know. And now I'm going to listen to heart and lung sounds in anterior fields, lateral fields, and posterior fields. And you can just breathe normally for me, okay?
And then as soon as you go and do it again, you forget it.
And now can you lean forward for me?
Video reaction, I look at.
All right. Anterior, lateral, and posterior lung sounds are clear, and there are no adventitious breath sounds heard. And heart sounds heard at Erb's point are clear, and S1 and S2 were heard. So it's all good to go. Now I'm going to inspect your abdomen. At this point in time, I would ask the patient to lift up her gown so I can inspect the abdomen, but for today's video, I won't be doing that. So the contour of the abdomen is flat, and there is no distension noted. There are no drains, dressings, or lesions upon inspecting the abdomen. When was the last time you urinated?
Probably this morning.
This morning? What time would you say?
Probably around 8.
8 a.m.? Okay, and when was the last time you had a bowel movement as well?
Probably 2 days ago.
2 days ago? Okay, sounds good. Are you experiencing any nausea or vomiting?
No.
No? Okay, and what's your typical diet like?
It's pretty normal. I eat a healthy diet.
Yeah, so a lot of fiber, a lot of greens and stuff. That is good to hear. And what's your appetite typically like?
I usually eat around 3 meals a day.
3
with
meals a
some
day?
snacking in between.
All right, sounds good. Now I am just going to listen to your bowel sounds, okay? And again, if you feel any pain, just let me know, all right?
Blood pressure was 156/76. Your systolic was a little high, so we'll keep an eye on that with routine blood pressure. Your heart rate was 88 beats per minute. Limits. Your respiratory rate is 20.
So I think when you
All right, bowel sounds are normal, active in all 4 quadrants, which is a very good sign. Now I'm just going to palpate on the abdomen. Okay, if you feel any pain or any tenderness, please let me know, okay? All right, no masses are felt and the abdomen is soft and non-tender. There are no signs of infection. Again, like I said, there are no lesions or anything. The only thing that concerns me about an infection is the temperature that I explained to you earlier being 100.4. Okay, now I'm going to move on to your arms. Excuse me. Do you have any weakness, tingling, or numbness in your arm?
No.
No? Okay, that is a good sign. There is no edema in either arm. Arms are expected for race and pink, and they are warm and dry as well. I am going to check for bilateral pulses. Right, pulses are equal bilaterally and strong, a 2+ as expected. Can you lift your arms up real high for me? All right, very good. And then can you bring it back down by your side? Awesome. Can you squeeze my fingers as well? All right, both arms are equally strong and patient has full range of motion as well. Again, there are no lesions or scarring on either arm, which is good. Now I'm going to move down to her lower extremities as well. Are you having any weakness, tingling, or numbness in the legs? No? Okay, that's good to know. Again, at this point in the assessment, I would lift up a gown to assess her legs, but for the sake of this video, I won't be doing that. So you said no weakness, tingling, or numbness. Color is expected for race and pink, and it is warm. Both extremities are warm and dry. Can you bring your legs up for me? Just bend your knees. All right, and then can you bring them back down? And can you lift your right leg up high for me? All right, very good. And can you do your left leg? All right, patient has full range of motion in the legs. And can you push down on my hands for me? All right, and both legs are equally strong. There is no edema in either leg, and there are no lesions, drains, or swelling in the legs as well. Now I'm just going to flip you over onto your side just to look at your skin integrity on your back, okay?
Okay.
All right. So your shoulders, buttocks, sacrum of your back, heels and thighs and such appear to be intact. There are no dressings or drains or signs of infection. Again, no redness, so that is a very, very good sign for being in the hospital. All right, you can lay back down for me, okay? And now I'm also just gonna check your skin trigger on your clavicle right here, or on your collarbone. There is no tenting present on this patient, so she appears to be hydrated. So how are things going for you in the hospital?
Pretty good.
Pretty good? That's good. We hope to be getting you out of here in a few days. And again, like, I'm going to talk to the doctor about your temperature and your blood pressure and see what we can do about that.
Okay.
Okay?
Thank
All
you.
right, it's good to meet you.
You too.